we have moved away from needs-based approach of things, and we took a rights-based approach. And rights-based approach simply means that the government cannot wake up this morning and say, we have no resources. And I say this with a lot of humility. Part of it is because I have seen cancer patients. I have lost 3 patients at a personal level, brothers and a father, for the simple reason that the hospitals were unable to treat these particular patients. So coming back here and looking at where we are as a government and where we are as a country, and you can see the debate, the discourse that was once NHIF, it has morphed into SHIF, it has morphed into SHA, but all these things happen because we have people in leadership who have decided that they can do what they deem fit for them and not necessarily for this country. The intention of law development is to cause some social engineering. But then we cannot say we are causing social engineering when we are actually subjecting many people to suffering. The question that this forum needs to be asking, was it necessary? Was NHIF transition necessary? We need to ask that. We also need to ask, what are these things we are supposed to do? And especially when you look at, I have had CHPs in this room, I've had paralegals in this room. What will be so terrible or difficult to continue something good that your predecessor has begun? Why is it that we always want to reinvent the wheel and in the process cause a lot of duplicity and in the process waste a lot of resources just because we want to be unique? And if you walk this country, you'll see many, many projects either by CDF that have been left abandoned simply because the people did not find it valuable in their political mandate. So as we move with this, I would like us to be asking whether health governance in this country is alive to what Article 2, Sub-Article 4 and 5 and 6 speaks to us about, that we have made commitments as a country to ensure that everyone has a right to good health. But closer to that is the Declaration on the Right to Development of 1986 that demands that it doesn't matter where you are, it doesn't matter your geography, neither your ethnic identity or gender identity. It simply means that you have a right to development wherever you are, in whatever state that you are in. But even as we discuss that, maybe you need to be asking yourself, for us who saw what happened at Kenyatta on Thursday, we are aware what happened, isn't it? That is an institution where people are supposed to go and be treated. But that's where people go to die, not because they have not been treated, because they have been killed. We need to look at all those issues and to contextualize them in where are we in terms of general governance, but importantly, what is our health governance telling us? The other thing I think we need to be asking is, what is the role of stakeholders, especially when you have a government that is very intolerant, that you can't criticize this government, but it's the same government that tells you that they don't know who is doing what and everything is happening anyway all the time. Those are questions we need to be asking ourselves, especially when you think that 40-something young people have been arrested in Isiolo. And I'm using the word arrested with a lot of cautious, because they could actually be abducted. So having said that, I would like to recognize the fact that we are in this room today, and we need to address several critical questions. So one of the questions we need to be answering is, how can you ensure that health financing mechanisms like SHIF are effective, transparent, and equitable? I like saying that Kenya suffers 2 major challenges that are within both institutions and in people. We have systemic challenges that we have handed over and over for many years. But you also have attitude challenges. And those attitude challenges sometimes come through with questions like, do you now have a PhD? Those are attitude challenges that we need to understand that we're in these positions because we were elected in those positions, and it comes with a particular mandate that we must live up to. If we can't live up to that, then you have no business being in those places. Please don't remind us of how many PhDs you have. Dr. Mkangu is here. I've not asked him how many. Because we did not elect you for you to tell us about PhDs. We elected you to serve us. And not just serving us, but rightly serve us. What is the role should accountability mechanisms happen, both legal and institutional, when you are safeguarding the right to health in this country? What is our role? And so what is the role of people in institutions? And I'm happy the Council of Governors, where Dr. works, has been on that, because health docket has been what? Has been devolved. But the question I'm asking is, when you are devolving health, did we give it the prerequisite resources? What is the intergovernmental relations that we need to deal with? When you talk about 15% that we can use freely as county governments, what happens to 85%? What is so big that 85% is doing? I was in Parliament the other day, and my good friend, Honorable Tika Juang, asked me why I'm behaving like an activist. And I reminded them that these people you are calling activists are the people who love this country. They love this country, they care about the Constitution. They love this country, they care about the mamamboga who is at home. They care about that boda person who has not gone to school, but requires some livelihood. And so they were telling me they can't touch 85%. And I was saying, oh goodness, what a waste. We have sold this country through the parliament, which is supposed to give us the protection that we require as a country and as a people. The next question we need to be asking ourselves is, how do we strengthen public participation in these processes to ensure that we have not only participated, but our voice and concerns have been adopted? It is only when we get angry, and we get angry, all of us. Gen Zs got angry at some point, and I would like to share in this platform that in 2004, when we were organizing some protests in this country, young people then, who maybe are my age now, asked me whether I have been paid to go and protest. This time, as I sympathized with them and gave them solidarity, I asked them, who paid you? Who paid you is the difficulties you're going through, isn't it? It is the anger, it's the hunger, it is the lack of basics that takes you to the streets. So we need to be paid so that all of us can get angry and go out there and state what you have to state. The other question then will be, what are the immediate policy actions that are needed to address the current inefficiencies within the governance system? And so we are fortunate today because we have a medical professional amidst us who will help us understand what does it take to deliver health and medical care services in this country. We have a litigation strategist who will also help us understand what is the law, what does it say, what are the gaps, what are the inadequacies, what are the strengths, what can we do. When you're talking about law, I'd like to remind you of US, and I'll not talk about US in the context of USAID, but I'll talk about it before I finish, is that the same constitution that Barack Obama used, the same constitution that Biden used, is the same constitution that George Bush and Trump are using. But you can see the result, isn't it? The result is quite different. And so sometimes it's not about the law. It is about people who use that particular law. And I would like to remind you that we have a culture around law in this country. How many of us were in the traffic jam today morning? What did you see that is so peculiar, but common in Kenya? Overlapping. And when this person overlaps and they find the other person who's been following the queue, do they expect to be given way? Do they demand? Yes. Do they abuse you when you don't? Yes. That is our culture around the law. We must just change that. That if the law is a good law and it demands that all of us queue, let us queue. It doesn't mean that you can't protest a bad law. It means that a bad law must be protested, but we cannot misuse a good law just because we have our attitude issues that we carry ourselves with. We also have a public finance expert in the room who will help us, community movement champion, and community members with lived experiences of how the system has messed us up. Having said that, I would like to kind of craft a context of what we want to talk about. If you look at the auditor's reports in this country, look at the Office of the Control of Budgets, do you find the courage and the energy of working on the streets? Because the reports are really grim, that we have resources that is constantly and progressively misused and abused, isn't it? And we don't seem to get anywhere with that. The report come 2025, 2024, 2023, and likely 2027. We're talking about the same thing, but no caveats have been put in place. We cannot talk about health, even with the good experts in the room, if we don't look at the geopolitical issues that are currently happening. I think we're already saying that people living with HIV, or people with HIV, are already facing problems. I was listening to Kingange, I think it was yesterday or today morning, and he said, and I don't know why he targeted Kisumu, he said, watu wa Kisumu mechi zipungue. Did you hear that conversation? Mechi zifanye nini? Why? Because condoms are not going to be available. And that is an effect of the geopolitical issues that we're dealing with. Trump has simply said, you said must do what? Must close shop. And I saw a clip where they were even removing the name of USAID from a building in the US. Meaning that if we have relied on resources, and I'm happy county governments are represented, from the diaspora, whether from bilateral, multilateral, or from our own people, it means we must sit down and rethink, isn't it? The second thing is that we have not learned from the KEMSA scandals. And particularly because the KEMSA scandals came about when you had COVID-19. And COVID-19 was a response to issues of vaccinations. The person in charge of that docket in the US is JF Kennedy, who doesn't believe in vaccinations. I don't know if you're aware of that. The question is, what kind of geopolitical relations are we going to create to ensure that our resources are used well without us having to go and beg? The other thing I think I would like to talk about is we behave as though COVID-19, whether it was true or false, did not happen, because the challenges we faced then with the elderly people, with children, with women, have not been addressed. And you never know what will happen tomorrow. So having said that, we go back to the law and we ask, so what have been our commitments as a country? We have committed internationally. We have a constitution that is progressive. We have institutions that we put in place. And we hope that all these things put together, they conspire to ensure that all of us have a right to access healthcare of good quality. I know young girls right now who will not be able to go to school because they're depending on USAID to get their pads. I know young people right now who will not go to school, partly because they are young mothers and there's nothing else that can be done. And I don't want to think like Magufuli, the late, God rest his soul in peace, who said, once you are a mother, you are a mother. But I'm bringing all these scenarios for us to do some soul searching and to agree that this country at the helm of health is at the wrong place, especially when we can arrest and torture the people who speak against what is medically and health-wise intolerant. God bless you.